He's the Executive Director to the Coca-Cola Bottlers Association. Mr. Haynes has served as President of the Association Healthcare Coalition, which aimed to improve healthcare options available to small businesses. Established in 1914, the Coca-Cola Bottlers Association assists a 73 members company in reducing costs by meeting their needs in a number of areas, including health insurance. Welcome.
Thank you, Chairwoman Velasquez and Ranking Member Shabbat, for this opportunity. I'd also particularly like to thank Chairwoman Velasquez for the leadership that you've shown over the years in trying to find creative solutions to the challenges facing the Small Business Committee, and most of all, frankly, for your authorship and sponsorship of the Choice Act, which I believe is a very well thought out and very powerful first step, and a step that will probably have much more implications than people may see currently if Congress chooses to support it, which I certainly hope they will, in really making a major dent in the problem that small businesses face. The reason why I believe the Choice Act is so powerful, and why I think I find myself in disagreement with Dr. Butler on a number of issues, is our own practical experience in serving our members, both in the healthcare and outside the healthcare environment. As I've indicated in my testimony, the association has been sponsoring and providing healthcare benefits for the members of our association for about 30 years. We had a very effective, very comprehensive program that included both our large members and our small members. Our members range from bottlers with as few as 12 employees to as many as 50,000. So we have that entire spectrum on both sides. And we were providing solutions to almost all ends of that spectrum, not the highest, but certainly the next layer down, through 2000, when the program we had built for our smaller members was disbanded because we could not find any carrier willing to support it. Our program has always been based upon a fully insured model, although it includes significant elements of risk shifting both to the association and to the individual members, and we simply couldn't find any insurance carriers that were willing to support the small member part of that pool, even though it was working very effectively at the time, and we had to disband that. I've been with the association since 2001. The single most important task that I pursued is how to reestablish that program. To give you an understanding of how important it would be for those members, healthcare costs represent in the range of 10% of the cost of a case of Coca-Cola, a 12-pack of Coca-Cola. We believe that our smaller members have as much as a 20% a disadvantage vis-a-vis their competitors or vis-a-vis larger members. That represents essentially a 10-cent per case competitive disadvantage between small and large members. And I have members with less than 100 employees who compete with businesses with as many as 40,000 employees. So this is a real world business issue for those members. And frankly, it's an issue for the consumers of our products who are buying those products in those territories. It either affects the profitability of my member or it affects the cost of the product or both. So this is a very important problem. The reason why I believe that the Choice Act is the right solution is it basically models the solution that the association has adopted outside the group health area. We have had a liability insurance program for 100 years. The single most powerful element of that liability insurance program is our captive. And we've had a captive that has operated very effectively for nearly 30 years. That captive has moved from taking a small part of the risk to taking almost the entirety of the liability of risk in our liability insurance program. And we are able to deliver a 25% premium credit to the participants in that captive while still being competitive with commercial insurers in the real world. So I, contrary to Dr. Butler, have real world experience that says this solution will work. It will work, I will guarantee, for our members. We could cover, I believe, the 60 members who are not currently in our group health program very rapidly under this program and deliver lower costs than they face today. Now, I think the issue that personally, as a fiscal conservative and who would be very sympathetic to Dr. Butler and his organization on virtually every issue, would look at and ask is, of course, the federal tax expenditure to subsidize this coverage. I have no trouble with that feature of it, and I think it's entirely supportable as expenditure of federal dollars. In my mind, what this subsidy will do, it will correct the uneven playing field that small business and large business currently operate on because of the disparate effect of all the state regulations on small businesses that are trying to pool. By equalizing that playing field and allowing us to create a cooperative, and in fact facilitating the cooperative, but including as a requirement of the bill, it'll put us in a position where we can put these smaller members back on an even playing field. It's, in my mind, the impact it'll have on competition, on allowing our members themselves to manage their risk as opposed to paying a carrier the profit premium that they have to pay to take on those risks. The reality that a carrier is going to be worried about adverse selection when a small business comes to them, is going to be worried about the reality that the people who are seeking insurance are going to be the people with the greatest health risk. The reason why our members pay so much more for insurance, in part, who are not in our program, is because of the premiums they're paying to the carriers for taking on those risks. And by simply pooling and retaining those risks, that profit part of the cost will come out of their cost and will be a real market-based savings. I'm also very confident that with the subsidy for the members that have under 100 employees, we could add double or triple the number of participants in our program among members with more than 100 employees and deliver lower costs for them. So the reality is, I think we would save more money internally than the federal government would provide us by a significant multiple. I think it's a dollar that would deliver, tens or even hundreds of dollars of benefits to the employees and our members. So I think it's an excellent solution. I welcome the opportunity to discuss the pros and cons of